Doctors of Reddit, have you had any exciting cases that have made you feel like Dr. House? My family pediatrician saved my life when I was 7. As a white ginger kid, I went in to see him with a fever over 100 and large red rashes, fearing scarlet fever. Upon consulting his books, through some house-like inspiration, he determined I had Parasitic disease, an autoimmune disease found predominantly in Japan, with less than 1,000 cases in North America. Then ensued the classic battle of House v. Cuddy to get me admitted to Sick Kids Hospital, with apparently over an hour of him arguing with administration while my parents waited next to my unconscious body. 2 days and 6 blood transfusions later, I was playing N64 and had no idea what happened. Just thank God you didn't have Honda disease. I diagnosed a young immigrant from Guatemala with a weird cardiac arrhythmia with Chagas disease in the ear. It was only on my radar screen. We never see it in the US, and it's never a diagnosis made by an doc, because my dad, a cardiologist, wrote a paper on it that was published a few months before. I'm from Brazil, and in middle school we learned about Trypanosoma cruzi, Schistosoma mansoni, Aedes aegypti, etc. I wonder if kids nowadays learn about them other than Aedes aegypti, which is alive and well, as the government has always worked to eradicate them. So I am a doctor, but I wasn't the one who made the diagnosis. It was during my first year of residency, and naturally I was running around like a madman seeing patients, answering pages, putting in orders, etc. An elderly patient gets admitted to the floor with chest pain, a very common scenario, for which the patient needs to be ruled out for a heart attack. The way in which we rule someone out for a heart attack is by checking an ECG. The patient's was fine, and cardiac enzymes in the patient's blood, which are biological indicators of damage to the heart. The patient's cardiac enzymes were very slightly elevated, so we had to do our due diligence and make sure they began trending down. When we went to check the patient's blood, the patient kept saying things like, "I ain't got no blood" initially. We just assumed that the patient was just tired of get stuck by needles and didn't want any further tests, which is totally the patient's prerogative. However, the patient also was very detached and not interacting with us at all, unable to get anywhere with the patient because the patient was refusing everything we tried to do and unsure of how to get through to the patient. We elicited the help of our colleagues from psychiatry. First, the resident came in and said the patient was probably depressed and just needed some counseling. Then, the attending psychiatrist came, and in her line of questioning, the "I ain't got no blood" issue came up again. Then, the psychiatrist went a step further and asked the patient, "Do you have any lungs, a heart, a stomach?" And the patient said no. This set of beliefs is called the Cotard delusion, or walking corpse syndrome, which is a psychotic syndrome, often precipitated by severe depression, where the patient either believes they are dead or that they have no internal organs. It's very, very rare and thus almost never thought. In any event, the patient did get ruled out for a heart attack and was then transferred to inpatient psychiatry. Nurse, check the man to see if he has any blood please. Doctor here. I received a call from Maya to admit a 50-year-old healthy man who's been having fevers for almost a week. No specific symptoms, just fatigue. The doc looked him up and down and saw none of the usual suspects: skin infection, pneumonia, flu. His routine labs show nothing except that his white blood cell, red blood cell, and platelet counts were a little low. Nothing to get excited about. Without even seeing the patient, I told the doctor to send his blood to lab to be checked for parasites. Boom. Babesiosis, the malaria of North America. My dad says he was the one to diagnose patient 0 during the measles outbreak in New York during 1991. He says when he called CDC that Friday, no one believed him, since it had been a pretty dang long time since anyone had seen it. He said the only reason he recognized it was because his little brother had gotten measles once, and the patient 0 had exact same symptom. Eventually he stared such a fuss that CDC did show up and confirmed it was measles, to which they put the kid into quarantine and began to do their thing. I bet the CDC guys felt like real buttholes after they found out he was right. Best one I've seen. 30-year-old male kept having recurrent meningitis. Everyone was completely stumped as to how this was happening in such a fit young chapter. Multiple scans showed nothing. It wasn't until he had an OGD, endoscopy, that showed a small wound in his esophagus that it became clear. Turns out he was fishing with friends about a year ago and had accidentally swallowed a fish bone but managed to extract it himself. Barium swallow showed a tract leading to his spinal cord from his esophagus. Nuts. My dad's an endocrinologist MD PhD. Introduced him to House when the show was on its second season. He ruined House for me when he would correctly guess the disease the patient was suffering from 20 minutes into the show. Oh, it was infuriating to watch in medical school. I would throw my hands in the air saying that's not how this works. That's not how any of this works at some point each episode. One of my colleagues was detailing the story of a young man who came to the ER with neck stiffness. He reported that this had been going on a few days, but didn't have fever or photophobia to otherwise concern us for meningitis. Unfortunately, he reported he had been to Africa in the past 2 weeks, and while this was the peak of Ebola season, he had been nowhere near the outbreak. He got a comprehensive ED workup including lumbar puncture and was ultimately admitted out of concern for symptoms and worsening clinical picture. Over 2-3 days labs continued to be negative, but he seemed to worsen and get more uncomfortable. He was especially reactive when people would enter the room and the door would shut loudly. An astute clinician realized the significance of this and ordered testing confirming the diagnosis of tetanus toxicity. The patient went on to make a full recovery. Toward the end of my fellowship, we had a patient come into the hospital from some rural emergency room. He was intubated and unresponsive. He had handwritten notes from the ED and pages of concerning labs, virtually no platelets left in his blood, failing kidneys, elevated liver enzymes. According to their notes, he'd been walking and talking when he went into their ED, and now he was barely hanging on to life in our ICU. Everybody was spitballing their own private ideas. Severe bloodstream infection, wacky cancer, ethanol ingestion, autoimmune disease, fulminant HIV, you name it. And it all seemed like fair game because we had zero intel on this guy. Meanwhile, I was assigned the very halcyon task of tracking down more information about this guy. Piecewise, I found out that he was a migrant worker who worked in the woods for a living, and that he'd be brought into the ED by his employer. I even found out that he'd been treated for a tick bite a few weeks prior. After gathering all of this information, I went into his room to find that the rest of the team was prepping and draping for a bone marrow aspiration. So I, in further House fashion, got to say, stop the procedure. In reality, it was more like, hey, guys, do you think we could hold off for a sec on this, but please let me have my moment. We discussed all of the details and decided to pull down the drapes and do a detailed skin exam. About 5 minutes into the exam, right as we were about to call it, we actually found an attached tick. So, we deferred the procedure, started doxycycline, and waited to see if he turned around. He stabilized over the course of the next 3 days. All that's missing from the story was someone playing teardrop while he was being presented on rounds. House was really popular at the time, so I like to think that if smartphones had been more prevalent, it totally would have happened. You are also missing the elevator ride with the patient's gown over your head while you poke around their vagina looking for a tick. Then have the elevator doors open seconds before you find it and have the family now staring at you. My father, who died in the 90s, was an orthopedic surgeon. A young girl of about 10 to 12 came in with her mother for a second opinion. She had broken her arm severely. It had been put in a cast, but it was not healing and it was hurting a lot. My father did an x-ray and didn't quite understand what he was seeing, so he took the cast off. It took a few moments, but he suddenly understood that the previous doctor had rotated her arm 180 degrees, or was it 360? I can't remember, and, in essence, put her arm on backwards, skin all twisted up. Not a doctor, but happened to my cousin. She was pregnant with her first child and suffering from incredibly bad morning sickness. Couldn't even smell food without throwing up. Her chef partner even had to shave his head as the smell of his hair after work was too much. She was very confused, very weak, all round not right. Her partner kept taking her to hospital, but they'd just get her hydrated and send her away again as they couldn't figure out why she was so weak, confused. until a doctor came along and looked into her eyes and saw she had rapid and focused eye movements all over the place. He immediately diagnosed her with Wernicke-Korsakoff syndrome. It hadn't occurred to anyone else as it's a disease of primarily alcoholics, caused by a B vitamin deficiency. I think at the time hers was either the first or one of the first diagnosed cases of it in pregnancy in the UK. She spent most of her pregnancy in hospital and lost her short-term memory, which took a year or two after birth to come back fully. Her son spent some time in NICU, mainly because of the drugs she was on, but he's a strapping 20-year-old now. Wow, I could imagine the house episode as I read this comment. About 2 years ago I had a young guy who had been in a moderate intensity car accident 2 weeks ago. He had some standard imaging done. Things were okay. He was following up in clinic for a check because he kept hearing a whooshing sound in his left ear every 1-2 seconds. On exam his ear canal is normal, nothing specific, and he is otherwise well appearing. One of the attendings then takes his stethoscope and places the diaphragm, the flat part, on the patient's left eye. He orders a CT angiogram and this confirms the diagnosis of cavernous carotid fistula. This is a post-traumatic bridge between a major artery and a large venous collection system. I had a patient at the VA who was complaining of tinnitus, or ringing in his ears. He had a long military career as a gunner, so at first I figured he was like a lot of my veteran patients who have tinnitus as a side effect of hearing damage. However, when I asked him to describe the ringing, he said it was pulsating. Usually, tinnitus is more of a high-pitched constant tone, though it can vary. Curious, I checked his radial pulse and asked him to tell me when he heard the noise. It was synchronous with his pulse. I took out a stethoscope and I could hear the pulsating, whooshing sound over his mastoid, bony prominence behind the ear. This is called objective tinnitus, as the observer can hear it as the patient can. I got an angiogram on him and discovered he had an unusual and dangerous connection between a major vein and artery in his brain, called a dural AV fistula. I reached out to my neurosurgical colleague who coiled the fistula and saved the patient from a possible rupture. I am a doctor, currently in my residency, which is my training after medical school. This happened during my 3rd year of medical school, my first clinical or in the hospital year. An old man and his wife of 40+ years came into the OR one night. He was having some odd pain in his shoulder along with other very vague symptoms. Nothing that points to one obvious diagnosis. We checked an EKG and did cardiac enzymes, blood work to check for cardiac damage when there isn't enough oxygen going to it. They all came back normal. The doc I was with thought nothing of it and we observed him for a few hours. His symptoms didn't go away, but they didn't get worse either. So I annoyed the heck out of the doc and asked to get another EKG and repeat some blood work. He gave me a look and started to ask me why I think it's heart related when everything was normal. I just looked him in the eye and said, please, just check it again, and if it's normal we can discharge him. We rechecked it and he showed faint elevations and a huge spike in cardiac enzymes. The patient began to cry, as did his wife, and I sat with them until they took him to the cardiac lab and got him an emergency stent to open the occlusion. Fast forward to the next day. I was on a different service but dropped in to see how he was doing. As I opened the door to his room there were close to 15 people in the room and they all became quiet. His wife stood up and as tears came down her cheek she said, "That's him." I can't tell you the emotions that flowed through my body as I had 3 generations of a family embrace me and thank me. It truly was an amazing feeling and makes me want to fight and help every single patient in my care. I really got to feel like Dr. House, as I had a patient with a history of a female cancer, didn't have old records, and was convinced she was infested with insects despite no visible insects. There is a very rare disease in which an ovarian tumor produces an antibody that affects the brain, causing psychosis and particularly the bug delusion. Turned out she never really had a tumor, just some precancerous cells removed, and she was just plain nuts. House always guesses wrong a few times, so we had something in common. You have been visited by the good sleep hamster. Subscribe within the next 8 seconds and you will be blessed with cozy and also restful sleeps. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check out another video, or don't. Either way, have a great day you magnificent people.